When I first got diagnosed with end-stage renal disease, I was a student in medical school. I was in the UK doing clinical rotations when I started to show signs and symptoms in a situation where dialysis is not available. Then I would have things like vomiting, diarrhea, fatigue, lethargy. If it gets really bad, meaning that I don't get dialysis for an extended period of time, I have had situations where I had seizures. I had arrhythmia when my potassium built up too high. I had blackouts. I had to end up in the ICU on 3 occasions. Well, currently we only have one hemodialysis unit in Grenada, which is privately run. And hemodialysis is a very expensive procedure. It's expensive to maintain. And optimum treatment would be 3 times a week. But because of cost, I would only do twice a week. You can survive, but you're not as strong as you could be. There is an alternative to the hemodialysis, which is peritoneal dialysis. The peritoneal dialysis is a little cheaper, and it's more convenient in that you can do it at home. Whereas for the hemodialysis, you would have to take time out of your schedule to go to the unit to sit there for 3 to 4 hours to get treatment. Patients who have severe heart problems, hemodialysis might not be the best treatment for them because it puts a lot of pressure on your heart. Whereas patients who have polycystic kidney disease with very large cysts, or patients who might be pregnant, or patients who are like very large in terms of size, who might not have a lot of abdominal space, they might not be able to accommodate the peritoneal dialysis. So it's a matter of knowing the patient and then getting to choose what is the best option for them. Because of the cost of dialysis, it's very difficult for the average Grenadian to afford. So if we can get more in terms of subsidizing costs, making treatment more readily available, it would be a lot better for the Grenadian public. I am not going to say government need to have their own dialysis per se, but at least if we had dialysis available at the hospital, so patients who are hospitalized don't have to get into an ambulance to get dropped up to St. Augustine's to get treatment and then have to get collected to come back. We need social and psychological support because it can be a lot to deal with. And even for the family members, it can be a lot to deal with. Because there was 2 occasions where my son had to be the one to find me passed out and call ambulance to come get me. That was traumatic for him. I think education is going to play an important role in. And once people get to know that this is what is happening, then they would understand better. Because sometimes you hear persons wanting to give you advice about what herbs to take and stuff like that. But there's a difference between kidney problems and end-stage renal failure. Once everybody is well educated, we're going to realize that having kidney disease is just like having any other disease. Once you get your treatment, you can live with it. A diabetic, once they get their insulin, they can live a normal life. They can continue working. So it's the same thing with kidney disease. Once treatment is available, then you can live with it.